Basically, CAR T-cell therapy is approved for the treatment of relapse refractory large B-cell lymphoma with 3 CAR T-cell constructs approved in this space. However, response rates with these drugs range anywhere from 50 to 80%, but about 40 to 60% will experience disease relapse post-CAR T-cell therapy. So there have been 2 novel bispecific CD3, CD20 bispecific antibodies approved in the space for relapse refractory large B-cell lymphoma, epcoritamab and glofitamab, and they've demonstrated response rates anywhere from about 40 to 50%. However, in each pivotal phase 1/2 clinical trial, they included about 60 patients, or a small subset of patients, who had previously been treated with CAR T-cell therapy. There's limited data known about this subset of patients, including prior treatment exposure and disease characteristics. So utilizing a consortium of 14 academic institutions, we compiled data on over 830 patients treated with CAR T-cell therapy, about 50% of which who did relapse after CAR T, and 64 patients who then went on to be treated with bispecific antibodies. We looked at patient and disease characteristics to identify patients who may be at a higher risk of not responding to bispecific antibodies. And what we found was actually that elevated LDH, bulky disease defined as greater than 10 centimeters at the time of bispecific antibody administration, early relapse, so defined as less than 90 days after CAR T-cell therapy, the presence of primary refractory disease, meaning that those patients were unable to achieve a complete response to frontline chemoimmunotherapy even prior to CAR T-cell therapy, and the presence of double-hit lymphoma by FISH, all correlated with an increased risk of or lower response rate to bispecific antibodies. Additionally, we found that overall response rates and complete response rates actually did align with the phase 1/2 pivotal clinical trials looking at epcoritamab and glofitamab, but that survival following progression of disease after bispecific antibodies in the post-CAR T-cell setting was quite dismal at about 75 days.